Welcome to Africa Dinner Table. This is a Zoom platform where we talk about the things that affect us as Africans, as Black Americans. We talk about our businesses, our health, the foods we eat. We talk to entrepreneurs, we talk to health officials like both of you. And today we are talking about the vaccination, the COVID-19 vaccine, the long-awaited COVID-19 vaccine. And I have on the show today, Mrs. Ada Nwadiaro, and I also have Mr. Ephraim Tedesi. In a moment, we'll be joined also by Dr. Isaac Opoku Asare. All three of you are from the state of Maryland, and all three of you have taken this vaccination.
Yes.
This is why it is so crucial that you speak to our people who have doubts about the vaccine. I am so excited. My name is Dr. Njideka Kelly. I'm from Houston, Texas. So welcome to the show.
Thank you.
We're just going to be talking, in Africa, you may or may not know, a lot of conversations happen on the dinner table. Once we finish eating, that's when the mom, the dad, the sisters, everyone is just talking about what happened that day or what they heard outside in the community or what have you. This is why we are at the African dinner table. Feel free to get your glass of wine, get your bottle of water, your food,
I think we
whatever.
should.
Okay, I have my bottle of water. Sometimes I have my glass of wine. But yes, this is what we're doing today. We are just conversing. But we are conversing on this important topic so that you all can tell us what you felt when you had the vaccine administered to you. So I'm going to start with Mrs. Ada.
Okay.
You are a vascular imaging specialist and you work in a hospital.
Yes.
Okay, so we heard that when this vaccine was rolled out, that first it will be administered to health officials. Right? Okay.
Yes.
So you went ahead and you said, here's my arm, jab me with the needle.
I rolled off my sleeves and I took it.
Tell us about what happened. What was the process? What did you feel?
Okay, so let me start from the very beginning.
Okay.
Okay, like 3 weeks ago.
Yes.
So my director called me and said, Ada, would you like to take the vaccine? He didn't get me. He left me a voicemail. So after 3 hours, I called him back. So he said, oh, you didn't call me back soon enough that they were taking a head count. That is kind of late now that he said no for me for the vaccine because all my other colleagues said no. I'm like, no, I would have taken it. So later, 2 weeks later, the day I took it, he called me again and said, do you want to take it? I'm like, yeah, I want to take it, sure. So I went to the place, I rolled up my sleeves, I sat down there and I took it. And it was nothing. I didn't feel anything. I just rolled up my sleeves and I took it. And the main reason why I took it was because of all the fallacies, all the myths, all the propaganda that is being propagated all over the place. So that was exactly why I took it, just to dispel it. And when I took it, I posted it on my Facebook page so that people can see me taking it live. So that was why I really did it.
Yes, yes, I saw that too. Now, Ephraim, was it the same with you?
Pretty much is the same story. Me and Ida we were asked by our director who want to be voluntary to take it, because at first we thought it's going to be mandatory.
Okay.
However, the hospital, once they secure the vaccine, they got from people to people and ask, ask the employees whether they need to take it or not.
Right.
So at first I was very hesitant, like as Ada said, because of all these rumors and, have they tested for on African people? Have they tested for people like, we have been exposed to malaria, any communicable tuberculosis, that kind of stuff.
Right.
And there's a lot of things going on, on social media as well. You
Yes.
might know. So I was very hesitant. And I said, well, I'm not going to be the first one to take it. So, yeah.
Yeah.
So other peoples before us took it 3-4 days ago, just 3-4 days ago. And then the day of the vaccine we took, our technical director, he called me and said, well, you don't have to register now. You can just walk in. Do you want to take it? I said, yeah, sure, I will take it. And I just made a random decision that I can, I can just go and take it.
Yeah.
So by the time I go there, when I see the line, you just forget everything, all the fears or all the people are lined up just to take the vaccine.
Right. Right.
So it's like it's gone away. I mean, like all the fears and all the talks about, this will happen to you, that kind of stuff goes away right after you see the line right there.
Yeah.
So I went there and, here you go. I just took it and
Yeah.
that
And
was
nothing
amazing.
happened. This has been at least 4 days, right? When did you all take it?
Okay.
I took it on Monday. I think Monday.
Monday, almost a
or
week
Tuesday.
tomorrow.
Yeah.
Yeah, Monday would be a week. Yes.
Mm-hmm.
A week
Yeah,
tomorrow.
Tuesday will be a week for me when I
And
took
Tuesday.
it. Yeah,
Right.
and I didn't have any side effects at all.
Right.
Yeah,
Right.
I didn't.
So, that is so important because Ephraim said two things. I like the two words. It's not mandatory and it's voluntary, right?
Oh yes.
So even
yes.
in the hospital, they ask you, do you want to take it?
Oh yeah.
Right?
Oh yeah.
That's
oh,
good.
yes.
I think that's good because a lot of people in the healthcare and even in education, teachers think they will be made to take it. However, we're doing this show to encourage people to take the vaccine. I mean, both of you just took it a week apart, maybe, and you're here. So all that talk about Facebook, yes, and
that brings me to, when I posted the thing, somebody called me from Nigeria. Actually, 3 people called me. They were like, Adobe, you took the vaccine. Why did you take it? There are a lot of negatives. I'm like, no, I took it. Nothing happened. This is me. You're talking to me. So one of them said, okay, what I'm going to do is I'm going to call you tomorrow and see if you're still there. So the next day, she called me.
Oh
I was getting ready to work. I'm like, I'm here. I'm getting ready, to go to work. Nothing happened. She said, if that is the case, I'm going to
here
take
you are. And here you are.
So she said she's going to take it. So I think it's good, more people come out and take it and show it so that people will see that there's actually nothing to it.
So Ada, what was your first inclination about taking the vaccine? I mean, Ephraim did say that he hesitated a little bit, but when he went and he saw these people online, the fear just, disappeared. But for you, Ada, what was it? I mean, did you just know that this has to be taken in order to combat this disease?
Yes. You know what? I work directly with patients. I've seen a lot of patients that suffer from COVID. So I'm like, no, this is bad. So when the vaccine came out and, this is something that will really help, I'm like, I'm going to take it. So I didn't hesitate one bit. Because I'm like, these are scientists. They rolled it out, so it must be good. I didn't want to be a statistic. I didn't want to anything happen to me, suffer COVID or bring it home to my children. And especially for my mom. My mom had cancer, and to God be the glory, she recovered. She survived cancer. So I didn't want to bring anything home that will, be disastrous for her. So I didn't want to take it. So for myself and my family, that was why I really took it. I'm like, no, I don't want anything to happen to us.
That was your motivating factor. So does that mean, and this is for both of you, that once the vaccine is rolled out to the public, that your families will take it?
For sure. My
Yeah.
families are taking it. Yeah. As
Yeah.
soon as it's made available to the public, they're taking it.
Yeah.
In fact, to tell you, when I got home and I told my kids, oh, but I took it, all of them jumped up and hugged me. You know, and they were like so happy. One of them took the picture that I showed and shared it to her, to his friends, and they were like, "Oh, congratulations, your mom got the vaccine!" So they were very happy. So I know they would take it. They wouldn't even hesitate.
They wouldn't hesitate. How about
No.
you, Ephraim? Would your
Yeah,
family take it?
my wife worked where I work. She's a
Okay.
nurse, and she took it yesterday.
Oh.
Yeah.
That's good.
Yeah.
That's very good. That's commendable. Yes.
Yeah.
Okay. Now, also, Ada, you put it on social media. Why did you do that?
Yes. I did it to encourage people. I did it, I put it live so that people will see, actually, I'm taking it. This is real. I'm taking it. And to dispel all the fallacies going around,
Right.
to say, yeah, this is real. You can take it, and to encourage people to take it, and nothing will happen.
Yeah.
Yeah.
Now,
Yeah, even you look great after you take the vaccine, Ada.
yeah. Yes. Yes. So now that you have taken the vaccine, both of you, how do you feel? How do you feel?
Nothing. When I took it, I just felt a little sore in my, at the spot. And that lasted for like 2 days, and it went away. Nothing else. I didn't feel any other thing. No fever for me, nothing. No fatigue, no headache, no tiredness. I didn't feel anything.
No. I read somewhere that there's bound to be facial disfiguration. I don't see that.
No, there were some people who get Bell's palsy. That didn't happen.
Yeah.
That
That didn't happen.
but that didn't happen to me at all.
So this
And
is
I don't think
it's all propaganda. It's all propaganda.
It is propaganda.
Yeah.
Because it's like a flu vaccine.
Yes.
The first time I took it, I don't even feel nothing. Even the person who administered the vaccine, she couldn't even find where she put the needles. It was very tiny one. It is very small amount, very small amount, very tiny small amounts, and you don't feel anything. The next day, I felt like my arms sore.
Yeah.
However, I don't have fever. I don't have anything. So the second day, somebody in our department was, found to be positive for COVID, which I have close contacts. So I said, well, I'm glad I took the vaccine. I know it doesn't protect it that soon. However, I went in and did the quick test right after it, because the person who had the COVID tested positive. She encouraged me to go because I have a very close contact. I work with her. So Ada may know that. So I tested and I tested negative. So I'm healthy. It's been,
Yeah.
My test turned out to be negative.
That was going to be my question about, now that you've taken it, does it give you more confidence to, just go out there? Do you still wear the mask?
Oh, yeah.
Okay.
You are encouraged after you take the vaccine to still protect yourself, still do the whole 9 yards, still wear your mask, wash your hands, do everything. Yeah, taking the vaccine doesn't mean you should just leave yourself. You should let yourself go now. You still have to do everything. Even if you get the COVID, it may not affect you, but you may transmit it to somebody, that didn't take the vaccine.
Okay.
Yeah, so you have to protect yourself.
So it's important that everyone takes the vaccine. Yes?
Oh, yeah.
Yes.
No doubt.
Absolutely. Everybody has to take the vaccine. So they have to know that the first dose of the vaccine doesn't protect you 100%. So, and you may know, since you are a doctor, your immunity will develop in a couple of days, and it doesn't protect you the day you took the vaccine. So you're gonna take the second vaccine.
Right.
Within
There
21.
are two, right? Two vaccines. When are you all taking the next one?
21
I'm
days. Within 21 days.
21 days.
21
I'm
days.
taking mine on the
Okay.
19th of January.
Okay, so that's about 2 to 3 weeks after.
Mm-hmm.
Yes.
Two
About
to
3 weeks
okay,
after.
okay. So in your place of work, would you say that many people took the vaccine or no? They still refuse.
Yeah, I
Um,
wouldn't say many. Efren, what do you think? I don't think a lot of people have taken it yet.
in our department,
Yeah,
I would say 60% of them they already took it.
60. Okay,
60.
okay.
That,
Just
that's a lot.
we have a very small department.
Mm-hmm.
From that, maybe from 12, almost 8, or that that that
Mm-hmm.
much a person took the vaccine. That much amount of person took the
Yeah, I'm
vaccine.
talking
So,
about, yeah, but hospital wide, because
Why?
with like
Okay.
6,000 employees, I don't think a lot of people have taken it yet.
Hospital wise, yeah.
Uh-huh. A
And do
lot of
you
people have
think
not.
it's because of fear?
Yeah, some people still have some misgivings. They still say they want to wait a little bit.
They want to
Yeah.
wait a little bit.
Mm-hmm.
yeah, they think they don't want to be a guinea pig. That's what they
Yeah.
think. We're gonna be a guinea
Mm-hmm.
pig. We're gonna. So
Mm-hmm.
a friend of mine who is our coworker, he told me that, well, after you took the second shot, I
Then,
will I will take mine. That's what he said. So
Mm-hmm.
yeah, yeah.
and
Mm-hmm.
nobody has taken a second shot yet in
Mm-hmm.
our
Mm-hmm.
in our hospital,
Mm-hmm.
but
Yes.
it will be soon. Like in one
Yeah.
week we will
In
know.
2 weeks, maybe, or in
Mm-hmm.
a
Yeah,
week. In a week.
yeah. For
Yeah,
us, it's 2 weeks.
yeah.
For some
For
people,
me,
it's
it's two
1 week.
weeks. Yeah, I'll be taking on the 15th.
Yeah, I'll
Okay.
be taking on the 19th.
19th, 15th, and 19th.
Mm-hmm.
So, what do you want to say to people in Ethiopia, Ephraim?
Uh-huh. What do you mean?
I mean, about the vaccine. Are they also having the same doubts, concerning this vaccine as in Nigeria? I know Adobe has a lot to say to people in Nigeria. How, what's going on in Ethiopia?
I don't. In Ethiopia, I mean, my wife traveled like three months ago for a
Okay.
wedding, and they think the COVID vaccine is just nothing.
It's not
I mean,
real.
the COVID is like, it wasn't too many. Not too many people is dying. That's what they think is the COVID is like nothing. So for the vaccine, I don't think they secure a vaccine yet. I haven't heard that.
Mm-hmm. Mm-hmm.
Uh, and but people who I know who lives in the United States, Ethiopian Americans, they most of them they want to get it,
Mm-hmm.
but they only be given to a frontline workers like us.
Yes.
Uh,
Yes.
yeah, so I want everybody to know that the vaccine we took is Pfizer.
Mm.
So there is another Moderna, but
Right.
me and Ada took the
That's
Pfizer one.
right.
Right.
Yeah.
Right.
So and also they are saying that the Pfizer might protect the new uh,
Strain.
coronavirus strain. Yeah,
Strain.
the
More
new
than
strain.
Moderna.
No, we don't know yet. I don't
We
know.
don't know yet, right?
Yeah.
We don't know yet.
Yeah.
So now, in Nigeria, I spoke
Mm.
with someone today in
Mm-hmm.
Nigeria, and she says to
Mm-hmm.
me, "Oh, this is all not real." She thinks that COVID is not even present.
That's what they say.
Mm-mm.
I don't know why they're having all those misconceptions. And there's COVID in Nigeria. People are dying in COVID, from COVID in Nigeria. I don't know if it's denial. I don't know what it is, but COVID is in Nigeria.
Absolutely.
Yeah, there's COVID in Nigeria. And what I would say to them is, if the vaccine does get there, they
Right.
should take it, you know?
Yes.
And if they're taking it, they should make sure they take it from a very reliable source. You know how Nigerians are now, the vaccine gets there, people will do the imitation of it,
Oh
the
my
fake
God,
version of it.
that
Yeah,
would
so
be deadly.
that would be crazy, but
Yeah.
I don't put anything past them. So people should make sure they take it from a very original, authentic source. But
Mm-hmm.
they should endeavor to take it because it will save life. It saves lives and it will save them.
Mm-hmm. Mm-hmm.
It's very, very good. They should take
Mm-hmm.
it.
Mhm. Also talking about Africa, again, Nigeria being a reference point, the Christians are saying all kinds of stuff regarding the disease. Um, it's ridiculous, but I've heard that the vaccine is supposed to be the mark of the beast. Has anyone heard that? I mean,
I,
how ridiculous is that?
I don't know.
Yeah.
That's why I say propaganda and fallacies. I don't know why they're making up all this. The saying is 5G. I don't know what they're talking about, but
Yeah,
that's not real. That's not true. I go to church. I'm a Christian, so
exactly.
I can't be blinded like that. So I don't
Exactly.
even accept any of those.
So it's
Yeah,
really
because
about ignorance.
it
It-
is totally
I
ignorance. Yeah,
It's
it
I
is.
ignorance.
also
Mhm.
I also heard. I mean, I live with my mom as well. My mom and I live in the same house. So my mom is very church going, and she told me that, as you said, this is like 666. So
That's what I heard.
they're gonna implant something
Mhm.
on your like a chip or something.
Mhm.
Microsoft will do, which I don't think there's nothing exists. The Pfizer we took, the only thing you have to do is you can log into the CDC website and enter information about your,
Effect.
after the vaccines. They're trying to collect the data. This is
Mhm.
voluntary. You don't have to do it, but you have to give them like what symptoms do you have after you taking the vaccines?
Yeah,
What is the side effect? So they're trying to collect data. That's the only thing. There is
exactly.
nothing. We see the clear fluid that is injecting, and we see that that's we
It's
have
not
It's
a
a
been.
chip.
fluid. Yeah, not
Yeah,
a
there is no chips and there's
yeah.
nothing. So
Mm-hmm.
that's is unrealistic. So
Yeah.
there are a lot of rumors which they talk about it, but I don't think those all rumors or any conspiracies exist.
And what will be the motivation for the world to do that anyway? I mean, I remember that I have children. All my children took vaccinations. I did.
Mm-hmm.
Back in
Mm-hmm.
Africa, I know that we had to take measles,
Mm-hmm.
um, uh,
Polio.
polio,
Mhm.
meningitis, and
Mm-hmm.
the rest of them. And I also know that there were people who did not take the meningitis. We saw the effects on the streets of Nigeria, and
Mm-hmm.
most of those people came from the north, the northern
Because
part of Nigeria. And
mm-hmm.
you will see these unfortunate children walking the streets with the aftermath of meningitis,
Mm-hmm.
right? So
Yes, yes, you're
why
very.
anyone will say this is what I don't understand. It really beats me.
I know. I don't know where they got the propaganda from. I don't know why they're peddling the rumors. I don't know what they stand to gain. I
Yeah.
don't know if it's because of what happened to the airmen. I don't know if that is the root cause of all this, but I don't know why they're carrying the rumors.
And
But
of
I
course,
just,
the United States didn't help much because, I mean, we've been known to be the big brother of the world, but it looks like we failed this time, right?
yeah, just because of politics. So they just said politics before the help,
Yeah,
So that I think
yeah,
that's what messed up the whole thing.
yeah.
Yeah.
So, do you believe that the vaccine will help in improving um, lives, and this pandemic will go away after the vaccine is rolled out more?
I think so. I think it will really stem the growth of it. Yeah. I think
Yeah.
if the vaccine is rolled out and made available to everybody and people start taking it, the rate of inflation, how people are getting will really come down. And then
Mhm.
the rate people are dying will also reduce. So the
Yeah.
more it's rolled out to everybody to get it, the better it will be. I think the outcome will be very good.
Yeah. How is it in Maryland, your state? How is what
The
what's going on?
COVID.
Yeah.
Yeah, of course. There are a lot of, most hospital beds are full.
Hmm.
So many places, even our hospitals, so many floors, you have COVID patients. So hospitals are getting filled up. But
Again.
yes, hospitals are getting filled up. Yeah, numbers are really going up. People are
Yeah.
dying
Yeah.
all of a sudden again. Yeah, so things are increasing.
Yeah. So, Ephraim, what do you want to say about social distancing and wearing masks as a form of, just abating this disease from just continuing to exacerbate the way it is? Should people still, maintain social distancing and wear their mask, despite the fact that there is a vaccine that's out already?
Yeah, I think everybody has to follow their country
Guidelines.
guidelines. But uh, for us, we have been told, and we have to wear a mask even though we took the vaccine, because we can we can get the virus, but we cannot get the disease. So we still can transmit.
Mm-hmm.
But it's going to be very, very limited. So taking the vaccine will give you a confidence, and it will give you the immunity. So everybody has to be immunized in order to just to take the masks and the social distancing off the chart. So still people have to wear the masks and keep social distancing, and also they can take the vaccine and be very confident about it.
Not
So
not
still,
suffering from it.
Yeah.
yeah, so still, I think still is an ongoing study. So we don't know the long term. As you may know, all the medications that we took
Yeah.
aspirin, they
Yeah.
never be, but this is the highest percentage of, this is, I want you to know that this is the highest percentage of Black people studied for this, involved in this study. In
Yeah.
Pfizer study, there is 13% of the populations of the United States is Black,
Yes.
including us, African Americans.
Yes.
But the study include 26% of
Wow.
the Black population. So I was on the lines to take the vaccine, and I was talking to one of a person I know from Asia. He
Right.
told me that they haven't studied this in Asia. They studied more on Blacks. That's what he told me. They only include, like, I think it's very low amounts of percentage in terms of Asians. So the Africans or Black Americans have to be confident. I mean, because this was the group
That
that
was
was
used the most.
hardly hit.
Yeah.
So,
Yeah.
so I think they include more than 200, almost 200%
Wow.
in their study. So that's the reason it gives to me that confidence that they did the study for
Yeah.
26% of the population, even though we are 13% of the
Yeah.
total population
Yeah.
wise. Yeah.
Yeah. Yeah. And even comparatively, uh, from the United States and Africa, many countries in Africa do not even have the same number of deaths, right? So many have attributed that to the weather. We've been told that this virus does not survive in hot weather. Have you heard anything like that?
Yeah, that's what we hear. But I know maybe because in Africa they don't really have good reporting system. I
Okay.
know people die. People are really dying, but
Okay.
because they don't report it or they will chalk it to something else. Yeah,
Mm-hmm.
but that's why they think they don't have a lot of people dying. But people are dying. There know people that are dying here more here, but people are still dying there.
People are still dying. Yes, it's
People are
a
dying there.
question of data collection
That
over
is
there.
exactly,
I see.
yes.
I see.
That is
I
that's
see.
what I think.
I
Yeah.
also heard in Ethiopia, I also heard, because many people get my wife family had a wedding. Her brother was had a wedding like 3 months ago, and more than 15 people gathered on the wedding, including the bride, the groom, and the groommates, the bridesmaids as well.
See.
and none of them died of it, because I think the strain they have right there right now is less
Yeah.
Virulent,
less
less
dangerous.
fatal. Okay.
Yeah.
Yeah, and
That may
also
be.
there is one another thing I heard in Ethiopia is they because many people took chloroquine for for malaria. So
Yeah.
they think that the chloroquine is preventing them getting worse. So this is a rumor. I'm not just saying this is
Yeah.
real, but there is a
That's
rumor
a
that
controversial one.
I know that's the controversial thing. I know.
Yeah, but malaria is common, and
Mm-hmm.
and chloroquine is the drug that we
For treating
use
it.
in Africa.
Mm-hmm.
So who
Mm-hmm.
knows? No one really knows. And the composition there too is something that has not been verified. So no one really knows. I think it's all about data, like Ada said. Now,
Mm-hmm.
from a social, or rather from a moral standpoint, what do you think about people who know that they are positive, they have symptoms, or maybe they don't have symptoms, and then they go to a wedding, or a gathering like that? I mean, from a moral standpoint, what do we want to say to those people?
Yeah, I don't think it's a good thing to do because they have it and they're not symptomatic, but they know they
And
have it
they
and they
know.
provide. Yeah, that is not good. That is not a good thing to do because they can transmit it to somebody who will have it and then they'll really suffer from it and may even die. So people should be conscientious. If you know
Exactly.
if you know you have it, try and quarantine, even if you don't have any symptoms but you've tested positive. Try and stay away for 2 weeks. Let it, blow by before you start mixing with other people. It's
Right.
not good because even though it's not affecting you, you may give it to somebody who will die from it. And how will you have that on your conscience? So
Yeah.
people should be very mindful of
Yeah.
that.
Yeah, that's the thing, because they don't think it's serious enough, I guess. And then I
Yeah.
also know that the way it affects some people
Mm-hmm.
is completely different from the way it affects someone else.
Mm-hmm.
So, that someone is positive may not show any symptoms, but
Mm-hmm.
then when they transmit it, it could be
Mm-hmm.
someone with a low immunity,
Yes.
or
Mhm.
someone who has some deficiency.
Underlying. Mm-hmm.
Exactly,
Yeah.
exactly.
Mm-hmm.
Yeah. So I think that's also one of the issues that's going on in Africa. So they go to these events, and those events become super spreader events,
Event. Yeah.
and that's not right. I don't think
Yeah.
that's right at all.
Yeah. It's not right at all. People
Yeah.
should have some
that's
decency not to do
absolutely
that.
Yes. Yes.
they should.
Yes.
I mean, if somebody has a disease, has a COVID, and they know about it, is
Yeah.
this is a collective effort to, to get rid of the disease. So it's not only you, but there are other people's involved.
Right.
Like, their immune systems are low. They can get infected and die of it. You may be young and you can,
Yeah.
but who knows? Even though you don't
Yes.
know
Yes.
how your immunity is and how you react from the
Right.
disease.
Mm.
So I think it's better to know people's. If you have any symptoms
Mm-hmm.
of COVID, it's
Mm-hmm.
better to avoid gatherings and
Mm-hmm.
spread the disease to others,
Mm-hmm.
which would be most of the time would be the loved ones.
Yeah.
So when my wife travels for the weddings, I say, don't do it. That's what I said. And the person whoever organized the weddings, we told them, don't do it. But eventually, they keep doing it,
Yeah.
which is not good. But they regret it after the wedding
Of
passed
course,
and
when they
everything.
get sick.
Yeah, they
Mm-hmm.
regretted. So it's better to be safe, pass this stage, and then we had the vaccine now. So most of the people will be immunized. I
Yeah.
hope they will be immunized, and some
Mm-hmm.
people, some develop herd immunity,
Yeah.
and then eventually it will decrease the chances of getting COVID or,
Right. Right, right, right. Now, I have a sister who lives in England who is presently in Nigeria, in a small town in the southern part of Nigeria called Oguta. And my sister tells me that she goes around with the mask, the
Mm-hmm.
face shield,
Oh,
and
for real?
gloves. And people laugh at her and think she's a weirdo. But this is the only way to prevent, this disease from spreading. Now, it's about the culture of the place. They do not understand and they don't believe that there is any such thing. And then even the ones you see wearing the mask outside, they put it under their chin. It has become fashionable under the chin, like a scarf or something. I mean, what is that about?
I don't know. It's just that they don't believe in COVID. I don't know why. They just don't believe in it. They don't believe in the disease. They don't believe you should even do, wear a mask and all that. So that's why when they see somebody wearing it, they laugh. But until somebody gets it, maybe somebody there gets it and the person dies, maybe then they will take it seriously. But because now all of them, maybe people will get it and then they will get a little sick and get well, they're not taking it seriously. But maybe until something really bad happens, then maybe they will take it seriously. Yeah. But what your sister is doing is good. Let her, no matter what they say, no matter how they laugh, she shouldn't mind them. She should just
continue to wear her mask.
She should continue doing what she's doing. She's doing the right thing.
Yeah. Ada has been doing COVID patients most of the time. So she goes to inpatient and she sees how people are dying.
Yes.
And this is how people are suffering. So this is real. Yeah. We witnessed, we have seen it. We have colleagues who died. We have colleagues. She passed away. Her brother passed away, and her mom passed away. And they don't. The mother doesn't know when her son passed because they were in a different hospital. Yeah. So this is real, and people are dying of it. And so once you get to the house in somebody's family, it can affect everybody
else.
And the bad thing about it is you cannot visit, you cannot see, you cannot hold their hand,
you cannot touch, you
cannot hurt them, so they will die alone.
Oh my God!
So you don't want to do that to the loved ones, So wearing a mask is, as you said, in what happened in Nigeria. It's also in Ethiopia. Also, is the same thing that happened because people wear masks. So I see when they go to the wedding, when the Augustus they get in, they have a mask. Right after 2 or 3 minutes, they took the mask off.
Wow!
And if you put a mask on, so you are like, who are you? Where are you coming from? I mean, it's like so.
Yeah.
So you are the only person. Like they look at you sometimes. They even, but I can see if it's a small towns. As a realized kid, so that might be true. But they have to be aware of it.
Yeah. Culturally too, there are another person I spoke to today, she said to me that in her community, also in Nigeria, they have, for New Year, they have some sort of cultural event where everyone in that community will have to drink, from the same cup and the same pot of some mixture. I don't know what that is. So, one person takes and gives to the next and the next and the next. And she says that's how they bond and that's how culturally they ensure that there is no, betrayal from
there are no
any of the people in the community. So this is a cultural event. And I said to her, with COVID, did you all do it? And she said, you have to.
Ooh.
Same cup, same pot.
That is crazy.
Whatever it is. So, in Africa, we have cultural issues that, will contribute to this disease spreading. And then we also have, many places have no running water. So how will they wash their hands? So, when they say that there's no COVID there, that's ridiculous. It's not true. It's not true. There's a lot, but there's a lot that we don't know. Just like Ada said, the data is not being collected.
Yeah,
so no one knows what's killing people, but people are dying.
People are dying.
This is real. This is real. Dr. Isaac never joined us. He's probably busy. So I think we've done, it's 5:45.
Oh, for real?
Yes, it is. When we're talking about something so important,
Yeah,
time just flies.
nice. Oh,
So I have another question that I want to ask both of you is, would you be willing to do more outreach programs such as this to educate people on the effectiveness of this vaccination?
yeah, maybe we can come around again. I'm speaking for myself. Ephraim, I hope you'll be able to do it. Maybe after we take the second one,
Yes.
yeah, then we can come back and say, okay, now I've taken the second dose. I felt
Yes.
like this, I didn't feel like this. So I think it will be good to have a follow-up.
Yeah, I would like that. I would like
Yeah.
that. Ephraim, what do you say?
Yeah, as Ada said, I think so when we took the second vaccine,
Mm-hmm.
Yeah.
now we know
Yes.
that the second vaccine will protect us 95%
Mm-hmm.
according
Mm-hmm.
to the study. And we'll come back and say some words if the
Mm-hmm.
Right.
people
Right.
Yeah.
want to know, if they have more questions.
Mm-hmm.
I mean, we can tell them after taking
The
the second
second one.
vaccine. Yeah, the second
Yeah,
one.
you know why? Because somebody told me, Ada, yeah, you think you took the first one. I think you'll really get the side effect when you take the second one. I'm like, let's wait and see.
Has
Yeah.
that person taken the first one? How
Not
does
at
she
all.
or he
Not
know?
at all. She was like, oh, no, I had this after you take. I'm like, how do you guys know? You've not even taken the first. Who took the second one to say how they, how they felt? Nobody have taken the second one yet.
Nobody.
So how do you
Nobody.
know? Yeah. So it's
Yeah,
just a lot of propaganda going around.
exactly. Yes,
Mhm.
I want to thank you all so much for this because we're definitely going to do that. This particular video will be edited and it will be posted on my YouTube channel. I will send you all the links so that you can
Good.
also share it.
Yeah,
Share it
that would be good.
amongst your, Facebook and Instagram and all the social media because we need to get the word out. We need to
Mm-hmm.
let people know that once the vaccine is rolled out to the public, let's encourage them to take it. That's the way we are going to save lives. Thank God we've gone past 2020. We don't want a repeat of 2020 in 2021.
Not at all.
Is that right? Yes.
Yes, yes,
So I
yes,
want to thank both of you for first your courage to even go on Facebook to announce this, and then your
Oh,
courage for actually taking it and for coming on this show to talk about it. I'm very grateful. We have a job to do. We
yeah.
have to disseminate information, good information to our people and any other person. So thank you so much, Miss Ada. Thank you,
Oh,
Mr. Ephraim. Now say your last words and then we'll end.
oh, well, I would like to say, well, thank you for having us. And I'm glad I'm able to participate because anything that will stem the spread of this COVID and help save lives, I'm all for it. So I'm glad I'm able to participate.
Great,
Yeah,
great.
thanks for having me.
Thank you so much for coming. Ephraim, your last words.
Yeah, thank you so much for having us and for giving us this opportunity to talk about the vaccines. We can talk other, other stuffs as well.
Yeah.
If we know if people, if anything they want to know, we can also talk about it. And thank you for having this opportunity and teaching our people back home and here as well,
Yeah.
so they can have an idea that, is all the social media rumors and everything that try to, I mean, people are lining up. If you look at in Florida, people are lining up to get the vaccines. These are frontline workers.
Yeah.
So I don't know, if you have a chance, don't miss it because you might not get it back. Yes, it's just take it as soon as you can because there's only 3 million people is vaccinated so far. So as soon as it's available to you, I think I advise everybody to just take the first one, and we'll let you know about the second one, how it will feel after we took it. Yeah.
I really like that. And for that
Okay.
second one, let's also invite people so they can ask their questions. Okay. Yeah. So let's have this is an introduction, but we'll keep doing this. So I want to thank you all, both of you, and your families for letting you talk about it too. Thank you for coming. And hopefully Dr. Isaac is okay and he can join us for that next one. So let me
Okay.
know, please. You have my information when you've taken the second one, and
Okay.
we will schedule a segment, okay?
Okay. Thank
Okay.
you.
All right.
Thank you
Bye.
so much.
I love you all. Happy New
Okay.
Year again.
Bye-bye.
And to your
Okay.
families, love and peace. Thank you.
Bye. Bye.
Bye-bye.
Bye, dear.